religion has played a major role in this, because most pastors believe that if you are not behaving well or you are behaving erratically, you're probably possessed, which is not supposed to be so. It's not supposed to be so at all. Unlike the foreign world, where they are more open, more acceptable, more accepting of mental health challenges. So talking to somebody that's not existing in your world, that's schizophrenia. You're talking to the air, that's soliloquizing. Although soliloquizing and schizophrenia are different things, but schizophrenia is more pronounced. You're talking to people who are not existing. So in this case, we say the person might have schizophrenia, or someone who is religious-based might say the person is possessed. So the challenge is that the mental health advocacy has not really been properly foundationally built in Nigeria. So that's why we have these challenges.
There's a lot we can actually talk about there. All right. I want you to help me clarify what you mean by somebody talking to somebody that is not there and being seen as schizophrenia.
There's what they call bipolar disorder. Bipolar disorder exists in a spectrum of the depressive mode and the hyperactive mode. So first of all, you are going from a state of depression, but a state of elevated mood to a state of depression. So we have bipolar 1, bipolar 2. That's our two kind of bipolar disorder. So in bipolar disorder, there is a existence of what they call schizophrenia. So schizophrenia is a mental health challenge on its own, but because of the interrelation of different mental health challenges, we have schizophrenia also existing in bipolar disorder.
Thank you for checking out this video. Are you getting enough value from it? You see, this video was created for the purpose of adding value to you. So if this video make any sense to you, let me know in the comment section below. I'm interested in understanding what you take away from this video and if it makes sense to you, so we can provide more. Now let's return to the video.
Seen as a psychologist or psychiatrist in Nigeria is not advisable. If you do your BSc in psychology in Nigeria, it's better to do your master's abroad. It's very, very important. Psychology is not really talked about. It's not a matured field in Nigeria, especially in places like Lagos, where you can see someone walking on the road wearing tattered clothes, looking naked and not even well dressed. So you'll be wondering, who is this man? Why is he not dressed well? Is there something wrong with him? So, but a psychologist will look at him and say he has not taken care of himself properly. He probably smoked colos or smoked marijuana, or he has schizophrenia that wasn't taken care of. So being in Lagos, practicing as a counselor or a psychiatrist in Lagos is very, very challenging, sometimes not rewarding. But the reason why it's not talked about enough is because mental health has not been truly accepted. Although during the COVID era taught us that mental health is very important. So the COVID era opened up doors of opportunities. People are working remotely, people lost their jobs. So a lot of people turn to therapy websites like BetterHelp to seek therapies. But still, the narrative has not been truly solidly on ground in Lagos, not Lagos alone, but Nigeria as a whole. You see parents locking up their children inside their houses, not wanting their neighbors to know their child has autism or schizophrenia or bipolar disorder, so they hide them from the public. So these are ignorant parents who don't understand mental health. They think he's a witch or a wizard that possessed a boy or their child rather, or possessed their child, so their child is behaving like a devil. So that's the reason why. And religion has played a major role in this, because most pastors believe that if you are not behaving well or you are behaving erratically, you're probably possessed, which is not supposed to be so. It's not supposed to be so at all. Unlike the foreign world, where they are more open, more acceptable, more accepting of mental health challenges. So talking to somebody that's not existing in your world, that's schizophrenia. You're talking to the air, that's soliloquizing. Although soliloquizing and schizophrenia are different things, but schizophrenia is more pronounced. You're talking to people who are not existing. So in this case, we say the person might have schizophrenia, or someone who is religious-based might say person is possessed. So the challenge is that the mental health advocacy has not really been properly foundationally built in Nigeria. So that's why we have these challenges.
There is a lot we can actually talk about there. All right. I want you to help me clarify what you mean by somebody talking to somebody that is not there and be seen as a schizophrenia. Give us more example on that.
Okay. For example, there's what they call bipolar disorder. Bipolar disorder exists in a spectrum of the depressive mood and the hyperactive mood. So first of all, you are going from a state of depression, right? A state of elevated mood to a state of depression. So we have bipolar 1, bipolar 2. That's our two kind of bipolar disorder. So in bipolar disorder, there is a existence of what they call schizophrenia. So schizophrenia is a mental health challenge on its own. But because of the interrelation of different mental health challenges, we have schizophrenia also existing in bipolar disorder. So schizophrenia is like you are talking to the air. You are talking to your surroundings, but nobody is there. Like you are seeing a vision, but not like if you are seeing a vision exactly, but you are talking to an entity that is not existing. And that non-existence of that entity is like you are talking to, you're in a different world entirely, like your own dimension. So you hear people talking in your head, you hear voices in your head, you hear people talking to you, go and kill this person, go and take out your life. You are nothing, you are not worth it, you are this, you are this, you are that. So those little voices distract the mind of a schizophrenic patient who is experiencing this mental health challenge. And this can be very deteriorating if not properly managed on time. So schizophrenia can be treated, but it cannot be, it can be managed rather, but it cannot be treated to the extent that it totally disappears, because it's a long-term illness. So, but with the managing of the symptoms become more manageable. So probably the voices will go lower, the visions will become less pronounced, and you can live a normal life. But except you take your medications. So medication is very important when a patient who is experiencing schizophrenia. So taking medication on time is really, really important, as it helps you manage the symptoms of schizophrenia.
All right, thank you for that clarification. That is very important for people that are listening to us. All right, now in your explanation, of course, even in your latest response, we could see that it is important that people that are having these kind of challenges are taken care of, are looked into, their cases are looked into. But you also said that in Nigeria, I can just comfortably say in many parts of Africa, we don't really take this seriously, whether it should be taken seriously. Because you are an expert in this area, could you help us understand why are we not taking it seriously? Because I would like to sort of dabble a little bit into if there are some spiritual angle, not only spiritual angle, maybe religious angle leading to ignorance, or cultural angle. Why are we not taking it seriously? The question that we are talking about here.
Okay. In Africa, Africans tend to be more, let me use the word, idealistic more than rationality. They tend to be more idealistic, and it's the state of idealisticity that leads them to make as Africans, it leads us to make certain choices. So when it comes to mental health, we tend to gravitate toward the spiritual angle, neglecting the fact that we can actually start thinking of this more rationally. If we think of mental health more rationally, we understand that cases like bipolar disorder, schizophrenia, it's not as if it's a curse that has been placed on you by a devil for the wrong things that you've done. It's just a state of chemical imbalance in the mind. But if the narrative is always around the fact that you've done something evil, or you've stolen something, or you offended your friend, and your friend cursed you, so you've been possessed by a devil or a witch because of that curse, so you have schizophrenia, that's a wrong mentality. Mental health is never like that. So let's not take things from a spiritual angle as Africans. Let us take this more from a rational angle, as health professionals. And that's why it's very important as health professionals like myself need to keep on advocating that to Nigerians that a patient that has schizophrenia or bipolar disorder does not mean that it's...
Hi, and thank you for checking out this short clip from Obehi Podcast. I'm Obehi Ituah, the host of the Obehi Podcast. This short clip was created from a full episode where we dive deep into this conversation. To see the entire video, all you need to do is to click on the link in the description of this video. Now, while you are there, I want to share something with you quickly. Are you a purpose-driven entrepreneur? Do you want to cut across the noise and attract the right audience, leveraging the power of storytelling? Now, pay attention. I'm currently working on a signature program to help you own your story and stand out for the competition. It's a 5-step journey to help reshape your professional and business narrative so you can drive success and stand out in the competition. And in less than 90 days. The link is what you see on your screen, academy.aclasses.org/story. Now, this is what we have understood. Storytelling is the most powerful instrument that is known to man. And this is what this could mean to you. You could either choose to own your story and leverage it to amplify your message and whatever you represent in this world, or some other person could own that story. The choice is yours. So why don't take advantage of your story and use it wherever you are, whether you are in business environment or you are a professional individual who want to be able to build your influence and leave a legacy behind because you represent something. You are owning your story. You are somebody whose story is important. So the choice again is yours. Now let's get started with this short clip.